All right, antimicrobial definitions that you're going to need to know. So first is antimicrobial, and basically this is any drug that has the capacity to kill or inhibit growth of a microorganism. Okay. Biocidal, this is an agent that attacks something that the microorganism has that the patient does not. We don't have cell walls, bacteria do. Biostatic is an agent that attacks something that microorganisms and the patient has, but the microorganism needs more. This has to do with folic acid, and we'll talk about the antibiotics that work with folic acid. So an antibiotic is a chemical, and it's usually a natural chemical, that works only on bacteria. The reason why I say it's usually only a natural chemical is because in the world of medicine there's a bunch of different words, and so an antimicrobial would be anything, so even synthetic, that kills bacteria. So that's it's just kind of tit for tat, you know. What is that, 6, half dozen the other. Doesn't really matter, it's just that you need to know, because sometimes you will see something that says it's an antibiotic or an antimicrobial, and the difference is that antibiotic is a natural. Okay. Antifungals are chemicals that are used to treat a disease caused by mold or yeast. Antivirals are drugs that are used to prevent viral penetration to the host cells, or it inhibits the virus production of RNA and DNA. And just as a side note, antibiotic, anti is against and bio is life. So that's where antibiotic comes from, is it's against life. Some other definitions that you need to know: bactericidal. Basically, this is an agent that is capable of killing bacteria. Basically, it kills key structures in the bacteria. So this would be like a gun, right? A guy with a gun shooting people. That is bactericidal. Kill, kill, kill. Bacteriostatic, this is an agent that inhibits growth or replication. So basically, this prevents division of the bacteria. So it doesn't kill the bacteria, basically it kind of holds it in place. So it holds up a yield sign. And what we're hoping for when we hold up that yield sign, one, it can't reproduce any longer, so eventually it's going to die out. 2, that the immune system kicks in and does what it needs to do to help the animal get better. Okay, so this would be the traffic guy saying, "Wait, stop! You can't go on. You need to wait for a few minutes." Okay. A few other things. Aerobic means that the bacteria needs oxygen. Anaerobic means that it needs to live in an oxygen-free environment. And basically, anaerobic bacteria ferments. That's how they get their energy from. So there is something called the spectrum of activity. On the slides you're going to see me talk about, I'm going to call it SOA. And the spectrum of activity, there's 2 types with antibiotics. There's narrow spectrum, and basically a narrow spectrum means that antibacterial will work on gram-positive or gram-negative, but it doesn't work on both. Okay? Broad spectrum is when an antibiotic works on gram-positive and gram-negative. So it can work on a variety of different types of bacteria. And this kind of brings me back to the bactericidal and bacteriostatic. Some drugs can be both bactericidal and bacteriostatic, and it depends on how much you're giving and what bacteria you're trying to use that drug, use the drug for. Okay. So there's something that how we tell if a bacteria is gram-positive or gram-negative is very easy. It's something that can be done in the clinic. You use a Wright stain for that. A gram-Wright stain for that. And basically what happens is you run it, you stain it, and then the bacteria, when you look at it, if it's purple, it is gram-positive, and if it is light red, pink, kind of, I tried to use that color here, it's gram-negative, okay? So it is something that's easy and can be done in the clinic, so it's one way of determining the proper antibiotic you need to use. Then we have something called resistance and susceptibility. Okay? Resistance is the state of not being susceptible to an antibiotic, and then susceptibility is the level of resistance of a particular antibiotic. So basically, resistance means that I could give an antibiotic as much as I wanted to. If the bacteria is resistant to it, it's not doing any good. Okay? Susceptibility would be determining what antibiotic you could use that would actually kill that bacteria. Culture and sensitivity should be done on on an infection that doesn't heal doesn't notice a change within 24 to 48 hours. Ideally, you should be doing the culture before you start using the drug, just in case it is killing some things off. Not all clinics do culture and sensitivity, but it is something that should be done responsibly, since we do worry about bacterial resistance in this day and age. So let's talk about why we use microbials. So basically, in this, you should remember this quote right here, okay? This definition: the goal of antimicrobial therapy is to achieve sufficient concentration of an appropriate drug at the site of the infection, okay, such that the infective organism is killed while simultaneously avoiding the side effects of the drug in the patient. So basically what this means is we use the right antibiotic to kill the right organism at the right place with the least amount of side effects to the patient as possible. Okay? It is important that we use the correct antibiotic at the correct time so that we can ensure successful treatment and prevent resistance. It is everybody's responsibility to prevent resistance. So another thing we think about with antibiotic therapy is, with other drugs, really all we think about is the patient and the drug. But with microbiotic therapy, with antibiotic therapy, we have to think about the microbe too. And so basically it's a triangle. They said it was a triangle of chemotherapeutic use, but I think a lot of times we think of chemotherapy and cancer. But what they mean by that is a way to kill the drug. There's a triangle to treat this infection. And so basically we have the patient here with the infection, okay? We need to think about the drug that we need to use, okay? And we need to make sure that that drug causes the death of the microbe, okay? And that microbe causes the infection in the patient. The other thing we have to worry about is side effects to the patient, okay? We have to think about the body's mechanism, the body's defense mechanism, how it's going to respond to the drug and to the infection. And then we also have to think about resistance. And I know this is really what veterinarians think about. Veterinarian will tell you, we're just going to prescribe this drug. But it's important for you to understand that there are factors that go into picking antibiotics that don't go into picking other drugs, okay? So the last thing that I want to talk about is how antibiotics work, because I think sometimes this is a mystery. We just think we take that pill and it kills off that bacteria that we need. Well, actually, it does antibiotics work differently. Different types of antibiotics work different ways. So we have cell wall agents, and basically these inhibit cell wall synthesis, okay? It only works on bacteria that is developing. So if the bacteria is already present, this drug is not going to work for it. It's basically going to hold that static, but not allow it to reproduce. Okay? Then there's cell membrane agents, and basically these alter the membrane permeability of the bacteria. Okay? There's protein synthesis agents, and basically protein synthesis agents inhibits the protein synthesis. So it works with the ribosome, and if the bacteria RNA doesn't match up, okay, with the protein production, it's inhibited. So if it doesn't match up properly, protein is not produced, and so thus growth is inhibited. Okay. Then there's antimetabolites, and these block enzymes or essential nutrients that to the bacterial cells so they can't divide. Okay. And then they die. Then there's nucleic acid agents, and these interfere with production of nucleic acid, and basically then the bacteria cannot divide properly. So there's 5 different ways really that we're going to talk about how the bacteria works. Antibacterials are antibacterias are pretty much classified in these 5 slots, okay? So we're going to talk about these this week. We're also going to talk about a few miscellaneous ones as well as antivirals and antifungals.